So good evening, everyone, once again. We'll be covering the fifth topic of the program, and that's understanding patients' expectations. And we'll be doing an activity to start with so that we really have an experience of how do patients feel when they come to us. And after the session, Dr. Vaibhavi and Dr. Farha will be making a presentation of their pedagogy. So I'll not can I request everyone to have their audio off because speaker off, sorry, mic off, so that there's no disturbance. Yeah, thank you. Okay, so I would request everyone to have a pen and a copy in their hand. And I'll be giving you a set of instructions, and accordingly, you will have to take some actions. Okay. And keep noting down certain points that I'll ask you to note down. So Dr. Ravi, are you ready? Dr. Ravi, are you ready? Because I'm not able to see you. Okay, great. Thank you. Okay, so the name of the activity is expectations mapping. I'm sure many of you must be familiar with the topic process mapping, because we do process mapping when we are doing quality implementation and working on the hospital functioning. But this is just once. Okay. I just need to tell that I can't speak. Give me a second, there's a call. Extremely sorry, yeah. So, so the name of the activity is expectations mapping. Now in this, you have to actually imagine that you are visiting your own hospital, but not as an employee or as a worker there or familiar with the hospital, but as a patient. You're visiting your own hospital as a patient. So we'll be going to different stations in the expectations mapping and just try to see yourself in the patient's position and see what you experience and how you experience. So imagine that you have an appointment in the hospital and you're visiting your own hospital as a patient. And in the process, please note down the different expectations that you may have, at every point of time or contact. Were they met or not met? Just keep noting down the expectations. So to start with, maybe like, imagine yourself entering the hospital gate for an appointment with your doctor. Now see yourself in the parking area, because you're going to park your car before you go to the hospital OPD. You are not a hospital employee, so parking person does not know you. And now try to recollect what are your expectations as a patient from the parking fellow, the person who actually helps you park your car. Just note down maybe 1, 2, or 3 expectations that you will have. And first note down, and then we'll see what we are going to do with this. And if you can quickly write met or unmet, you may have a set of expectations that may be met, that may not be met. So met or unmet, you can write. Or for met, you can write M. For unmet, you can write U. Then see yourself at the reception of the hospital, wherever your hospital reception is, to confirm your appointment and the availability of the doctor in the chamber. Your appointment is confirmed and you have been asked to wait, as there are a couple of other patients before you. It'll take at least around, say, 45 minutes, according to the receptionist, before you can see your doctor. Check your expectations that you have from the receptionist in terms of her behavior or quality of interaction. list down the expectations you'll have from your receptionist. I'm giving you a couple of seconds to note down. I think there's some message by Dr. J.P. Kapoor. He's asking for the passcode. Can somebody write the passcode in the group? Okay. Now, see yourself in the waiting area. Look for place to sit. Are you happy and comfortable about the waiting area? What arrangements in the waiting area would have made you feel good in case if you think those facilities are not available? Just note down what facilities would have made you felt good about waiting area. Are they there? Are you okay with the waiting time? Because you were told by the receptionist that it will take at least 45 minutes. And you know what is an average waiting time in your hospital or in your own clinic. So you could write even that same waiting time for each patient. Are you okay with that waiting time? Now your turn comes for consultation. You visit your doctor, and since you don't know your doctor, you're not working in that hospital, and the doctor also does not know you. You are just having an interaction like a patient with your doctor. What would have been your quality of interaction? And what would be your expectations from that consultation? Just try to list down a couple of expectations that you'd have from your doctor. Also check whether those expectations were met or not met. You have been asked to get some blood work done. See yourself at the lab and try to see what expectations you would have from the lab, from the technician, from the place where this lab is. Note down these expectations and write in front of them, met or unmet. Dr. Kapoor, we are doing an activity where we are visiting our hospital OPD as a patient. And we have already entered the hospital. We have met the receptionist. She has informed us that it will take at least 45 minutes. We are waiting in the waiting area. Then we have met the doctor. And now we have gone to the lab. Now, after the lab work, you go to the hospital pharmacy to buy the medicines your doctor has prescribed for you. Again, try to focus on the expectations you would have from any good pharmacy and note down whether your expectations are met or not met. Before you go back to car parking to go home, you felt the need to use the restroom. Look for the restroom and check your feelings after using the restroom of your hospital. You are a patient. You're not using any staff toilet. You're going to use the patient toilet. Look at your feelings after using the restroom of your hospital as a patient. Were your expectations from the restroom met or not met? Get into your car to return home. Are you satisfied with your visit? Are you satisfied with the facilities for the patient? Now, segregate these expectations into realistic and unrealistic expectations. So in front of all the expectations that you had right from the beginning till end, on the right hand side or on the left hand side, you can write down it's a realistic expectation or an unrealistic expectation. So whatever expectation you have written, take a minute, right from the first one till the end. Padma, I understand because you are not working in a hospital, but definitely as a patient, if you have gone to a hospital, you can understand what is. You'll get to understand it because ultimately you will be using this topic to help your staff understand what patients expect from us and what sometimes we think is unrealistic expectation and how sometimes we don't care to fulfill that expectation. That's the whole learning from this. So once you have done it, just let me know if you have been able to write realistic and unrealistic in front of each expectation. Could you identify any unrealistic expectation? Anything that appeared unrealistic? No? Yes, please, Dr. Ravi, go ahead.
Ma'am, main unrealistic was the first when you said when we go to the hospital and we are parking the car.
Mm-hmm.
So we would expect that, the security or whoever would guide us to some parking slot, or if it is full, he would take our key and park it later. It is never done.
Of course.
So it is very unrealistic, but we just expect it if it happens.
But a lot of
I've
hospitals are
never seen
offering
it
this
in any
now.
hospital.
A lot of hospitals are offering now. If you go to Max, Shalimar Bagh, there's a valet parking.
Yes, yes.
Yeah.
Those are the big corporate centers I'm just talking of,
I understand because that's something, I mean, it's still not considered as one of the services that we can provide. But yes, we all know, especially when the patient has come alone or when the patient is in serious condition, especially it's an emergency situation, usually you'll find people who would say, okay, we'll park your car, you take the patient in. I mean, we are seeing this happening. Yeah. So Dr. Janvi has written that all the expectations are very realistic. We can at least, okay, give them guidance for the parking. Yes, I agree. So if the same expectations came from patients, would we still call them realistic expectations? Yes, sir, please go ahead. Yes, Dr. Rajesh, please unmute your device.
The issue is that, since almost all of us are doctors over here and senior specialists as well as administrators, the whatever expectations which, if generally like Dr. Ravi also mentioned, that it may seem or it might have seemed unrealistic, but they are all realistic. Like as you mentioned, like in Max also, like parking area. Like I can take my own example because at least I got the liberty of taking my own hospital's example. Like once I also being a head medical administrator myself, I found it myself to park my own car, and then we did a remedial because I got stuck up. So then that was the time that ideally as a head of the medical admin I should have thought about it, but generally parking is never in your frame of mind when we are dealing with senior specialists and their requirements and patients' requirements.
Yeah.
So, so almost, ma'am, whatever which we will be talking about as unrealistic would be a realistic. And I totally agree with Ravi, Dr. Ravi also, that it may seem unrealistic for others, but for ma'am, but it is realistic and we should strive for that, in fact.
So actually, yeah, Dr. Ravi, you wish to say something. Please go ahead. Yeah.
Sorry, ma'am, and only one more unrealistic. I mean, it is again from the patient's point of view, not, but is the time. You know, you did take an appointment, but very often we find doctors, especially if someone is a surgeon, they get delayed in surgery coming. I have experienced this as a patient on several occasions.
Yeah.
That the doctor is late in his surgery, coming in traffic, and you're waiting and waiting and waiting, and we've waited very patiently, but it's patients do expect that we have got our time, and we have seen others fighting over it
So,
as
Dr. Ravi,
waiting in a doctor's room.
absolutely. So, Dr. Ravi, if you are late once in a while, or if surgeon is late once in a while, it's understandable that it's circumstances that has led to. But the day we will start valuing patients' time, the day we will have a focused attention to the idea that we should stagger in a manner patient waiting time can be minimized, and also we have patients back to back so that we are also not wasting our time. I think that's what we are looking at. See, there was a time patients did not have any expectation. Probably the basic expectation was, please see me, write me medicines, cure me, and let me be fine. That's all. If you made me wait, it's okay. If you make me come back, I can come back. There's no problem. If you don't give me medicine today, if tomorrow, if you ask me to come and get the lab test done, I'm okay. I can go home. I'll come back tomorrow, get my lab test work. In RML hospital where I went for the assessment, can you believe a message on the lab was, your reports will be available next week on the same day in the OPD. I asked a question, if you will give the reports after 1 week, what is the relevance of that report? What is the relevance of that report? I asked them if the patient needs the report today, where will the patient go? What I'm trying to say, all this while we did not look at things from the patient's point of view. But now we know patients' expectations have to be considered. One, because they are paying for it. Second, they are stakeholders. They are team members, and they are the one for whom we are existing. Why are we all here?
Ma'am,
yeah, go ahead.
Ma'am, I put it as unrealistic, just a personal experience that I will have maybe, say 8-9 patients who take appointment and come. But there are 30 who come without appointment. And I'm ashamed to say, but my average waiting is 2.5 hours, and I feel terrible about it. But what can you do? And there's, it's a big, so that's.
So although the topic of patient expectation was planned, I'm answering your question. So the topic of patient expectation was initially planned with the idea that I want to introduce to the trainers that you need to talk about this with the hospital staff. But I have actually changed the content, because every time I'm having the clientele who are actually administrators, or who are the one who are actually creating systems to make things work better. So at the end of the presentation, or towards the end of the presentation, I am going to equip you with a wonderful tool, internationally used tool, which will help you to actually change the way your hospital works. Many of you may be already using it without knowing what you're using. Many of you may be actually using it knowing that you know the concept. And many of you may not be knowing this concept. So you are going to really love it, because that's what is going to help the way we are all functioning and how we can change the way we are functioning. So I'm going to help you, learn that tool. Of course, I will not be able to teach you the complete tool, but the whole idea will give you an idea that you can actually take a formal training in that tool. But I'll talk about it after a while. So I think this small activity gave you an idea where all patient actually would have a point of contact. And they will always have some expectations, said or unsaid. There was a time they never said anything. Even if their expectations were not met, they were fine. Even after paying, they were ready to wait. They were okay if they were made to come back. But today we all know things are not the same. If you want to have good reputation, if you want to have good name, if you want to retain your patient, you have to look at things from the patient's point of view. What do they want? What do they need? What will make them happy? What will add convenience to their reaching us? What will actually promote access to these services so that they find it convenient and useful to to reach us and to avail our services. So the whole idea is, can we try to understand patients' expectations? A lot of time we just shun away this, saying patients have unrealistic expectations. This is not possible. Are they coming to 5-star that they are expecting a valet parking facility? Or what is it? They want toilets to be like 5-star, they want waiting area to be like 5-star, and they look for a lounge for lying down. Now we realize that no, it's not just the patient, it is the family also is suffering. And you see, if you have a patient in the ICU, there's a queue of relatives, and there will invariably be 2 or 3 relatives who will be actually doing round the clock, staying in the hospital, even if they are not allowed to go and see the patient every time, but they think, in case if I'm called, I have to be around. In case if I'm required, I need to be around. In case if they ask me to get some medicine, I need to be around. So that means they are going to be waiting somewhere. So where do they wait? There comes the need for waiting area. So everything now is being planned and designed, keeping in the patient and the family. It's not just the patient, it is the family. And now it is not just the patient and family. I would say even your team members, your staff, your employees, even they are stakeholders. Do I really care for their convenience and their comfort? A lot of time we see security guards standing outside. 6 hours duty, 8 hours duty, sometimes 10 hours duty, 12 hours duty, and they're constantly standing. I ask them, aren't you provided a chair? No, ma'am, we can't sit. We are not allowed to sit. Put yourself in that position. Stand into their position and see, is it humanly possible to continuously stand for 12 hours or 10 hours? That's what I'm trying to say. Understanding expectations of people who are actually the team, part of the team, or who are the stakeholders. That's what I'm trying to bring about. I think, Padma, you wanted to say something. You raised your hand. Go ahead, please. Yeah.
What you said is 100% right, ma'am. We have faced a lot. Even the coordinator not allow us to speak with doctor. What happened if we undergone the angiogram? What were the consequences after that? If there is a blockage, what is the other process we have to follow? How many days we have to stay in a hospital? We requested that coordinator like anything, but she did not even allow to speak with doctor for 1 minute also.
Absolutely.
And the day we have gone through, my mother gone through that angiogram, there was no seats. We 4 people went there. My daughter sit in the, she could not stand much time. She sat in the bathroom. There is a small step to step into the bathroom. She sat over there, and remaining 3 of us, 1 hour, 1 person standing, another one, we were shifting the roles to sit in the seat. And we were not allowed room, as she was in a process room, what we call that room, I don't know, where we have to take a food. That was also big issue for us.
So see, these are the things, these are the very genuine requirements of the patient and the family member. And are we able to actually understand and address that? I think that's what we are trying to understand through this session. So this is more like beginning of what we are going to talk in the future session. But I said this has to be the baseline. that do we really understand patient's expectation? Yes, Dr. Kapoor, I think you wish to add something. Go ahead, please.
I really wanted to say something more. Definitely, all those issues which have been raised are very pertinent one and very important one. But at the same time, somehow perception has to change. In medical science, nothing is absolute.
Yeah.
If I say I will operate one patient in half an hour, you never know the complication happen and that patient takes 1 hour to operate and the next appointment gets delayed by half an hour. Same way, if I'm seeing a patient in OPD, that patient wants to talk to me a lot.
Yeah.
That's what you're told. Never interrupt them.
Yeah.
I want to listen to them. That appointment which I've given for the next patients was 15 minutes after the first patient. But if I interrupt him, I again become a bad doctor. If I want continue with that dialogue, which he wants to say, I delay the next appointment. So nothing is absolute in my medical science. The one thing which I again want to say, look at the another doctor who has ran for 3 miles when a car was stuck in the thing.
Absolutely. Absolutely.
We are very, very insan people. If we become good doctors, appointments can never be kept.
So, Dr. Kapoor, see, I'm not saying that you have to have an iron cast kind of a time management. Of course, there has to be flexibility, but most of the times you will be successful if you have that approach of managing patient's time, valuing patient's time. That's what I'm trying to, talk about. That do I really look at it from the patient's point of view? Sometimes we make them come again. Sometimes we cancel the appointment without informing them. Can we at least cut down on those things? That's the main idea I'm talking about. And not just that, lot more we are going to talk about. I just want to read Dr. Farha's comment in the chat box, and she says, all unrealistic expectation can be made realistic with enough time and space. Yes, much more than that, Dr. Farha, it is the intention to find solution to the problem. See, I went to RML hospital and there the residents were on strike. Usually the OPD size in RML hospital is something to the tune of 6,000 to 8,000 in a day. And they had not made any announcement to inform general public that please do not come to hospital. The hospital residents are on strike. Patients are coming, going around in the hospital, asking people, where can we get the card made? They are making card only early in the morning from 8 to 9 or 8 to 10 because only the consultants will be attending to the patients and not the residents. So naturally, they have to cut down the workload. But if I value my patient's time, at least I can put a public, some system, even in the newspaper, if I can put a message that residents in this hospital are on strike, please do not visit till we inform you that the hospital has opened, has come down to the regular functioning. So intention is more important, and that is where the management and your desire to bring some change in the way we are functioning. Now, this lab that has put on the board, your reports will be available next week on the same day in the doctor's chamber. Mm-hmm. I mean, did anybody think, what about those patients who require the report maybe in a day's time? That's what I'm trying to bring our attention to. I want to read Dr. Deepika's comment in the chat box. Patient expectation, if not met, but at least should be managed by keeping them informed and acknowledge their expectation. Absolutely. So even if I can't help, can I acknowledge, I'm really sorry, you had to wait. I was busy with some activity, or the doctor will not be able to come because he's stuck in a surgery. Can we inform or give them a choice? See, the doctor is going to take 2 hours. Would you like to go and do something and come back after 2 hours? Would you like to reschedule your appointment? But we take this for granted. Patients will wait. They will have to wait. That's what I'm trying to bring your attention to. So I'm going to now take your attention to the case study that we have given in the handbook that we have. Did anybody get a chance to read it? You have read it. I've given a number of case studies in that, but we'll just pick one of them because we have a lot more content to cover. And if anybody can read it for everyone, and if everybody has read, then I'll straight away go with the question answer. How many of you have not read? Raise your hand. Not read? I had put the message. See, I request if there's a message in the master group, please read that message as soon as it is, posted. I would never post unnecessary messages in that because I know it's a very professional group, so we don't post. But if I put a message, I request you to read that message. Who all have not read? Please raise your hand. I think except Padma, everybody has read.
Yeah.
Okay, Dr. Janvi also has not read. Who else? Okay. So very quickly, I think we will go about, you can open the document, you can read it, and we will we'll start the discussion. So I want to ask you a couple of questions about it. Give me a second to open my document. So if anybody can briefly narrate the case rather than rereading the whole thing once again. Dr. Kapoor, will you do this? Thank you, sir. Go ahead, please. Yeah.
There's a patient which is having some chest pain, which his name is Abdul, and he has come to the hospital with a daughter, Jeenat. I remember it vaguely, and Dr. Raghavan has come and seen the patients. He has done some treatment part of it, and after treating that, some treatment was given. He left, and he comes back. I will come soon and see you again. But 2 hours have passed. Nobody has come to see this patient again, Abdul. And now Zenith is feeling uncomfortable waiting for the doctor. There's one more character. I don't remember the name. And
Wife's name is Zenith and daughter's name is Katrina.
Katrina.
Yeah.
The Katrina overhears doctor's conversation with the nurse, and they really found that he's saying that, no, I'm not very free at the moment. I'm very busy. And do you think I'm free and I will come and again see that? He overhears and narrates it to the mother in a very different language. Ki, the doctor to aise keh raha hai, aise keh raha hai. And ultimately, they think, let's leave. That they don't have the time for us. We want to go home. I'm feeling better. Abdul says, I'm feeling far better. I want to go back home. And ultimately, that's a crux of thing, that lack of care for those 2 hours really didn't fit to the expectations of the Abdul and the family, and they really think that patients is not being cared for. No treatment is being given for last 2 years, and I'm feeling better also. But they were saying, we are monitoring at the moment. We will definitely come back if the months of monitoring is over.
They did not say this, Dr. Kapoor.
They didn't say this. They didn't say this.
Had they said it, then probably everything would have been fine with the family, because they knew that they were being observed, they were being monitored. The patient was being monitored, actually.
Yeah.
See, we do everything in the patient care, but we do not inform them, assuming that it's our prerogative. And we don't think it's important to let them know what we are doing, why we are doing, or for how long is that going to go on. So if I may ask all others who have read this case, what exactly do you think? And is this something very uncommon? No. So now Padma shared her experience about her mother's angiography. And there's a patient coordinator. These patient coordinators are kept with the idea that they will do the talking instead of the doctor doing the talking, because a lot of time doctors are busy. We keep patient counselors, assuming that these patient counselors will do the fill in the blanks for the questions that the patient wishes to ask. These counselors will, answer those questions. But incidentally, do we check the quality of the interaction they have? Now, Padma has shared her experience that she tried asking the coordinator what procedure you have done, what is the scope, or what alternative option we have, how long will it take, and many other questions. So what questions did you have, Padma, if I may ask you to briefly tell your what questions you had?
Actually, I asked her, if you go for a angiogram, if there is a blockages, what blockages are there, what is the next treatment?
Okay.
If you are going to put stent, how many days we have to wait? Whatever, if there is nothing to be there, when will you discharge us? What are the tests we have to undergo before? She's telling, keep on telling, what is the condition we can come to know only at the time of angiogram. We can't tell the treatment what we are going to do before diagnosis. That is what he was saying.
So
But
Padma, may I ask you something? I'm sorry I'm interrupting you, because I want to just keep this discussion for us to learn from your. So
Okay.
were you not counseled by the doctor, the cardiologist who did the angiography for your mom?
He said only one thing. We have to go for a test. In Bangalore, they said even though you have undergone the treatment for the test of angiogram,
yeah,
we will prescribe the same medicine. Why unnecessarily suffer her in this case?
Yeah.
Because of her complications.
No, my question to you was, were you counseled?
No.
No. Okay.
We were not counseled.
Okay. I'm sorry I'm parking you here, because we want to come back to the case study so that we learn from that case study. Now, this case that we have discussed just now, it's a very regular thing. In the emergency, a patient comes with chest pain, they are apprehensive, they are very concerned. Is it cardiac condition? Is it something very serious? I mean, we would all do everything that's required. What do we fail at? We fail at communicating, because the old practice was that there is no need to talk about it. That's our responsibility. They are there, they will wait, they'll go only if we ask them to go. But today they want to know what is happening, what we are doing, So if I may ask you in this, did you see that the doctor and the nurse went out of the room without telling anything to the patient and the family? Did you read that? And doesn't that happen often? Now, my question to you is, should the Rahman family have known that Abdul was continuing to be monitored? And how might have they known this? And the doctor, please go ahead. Yeah.
No, when the Dr. Agan was telling that when he told the patients that I'll be back in a moment, when he had already checked the patient.
Yeah.
So at that time itself, he should have been telling the patient as well as the relatives that he seems to be okay, but still we'll have to rule out certain things and we'll monitor him.
Absolutely.
So those two sentences would have made a lot of difference. It would have been soothing for the patient also, and a positive way of communication would have been there.
Absolutely.
That was the crux of the thing.
Absolutely. So even Dr. Ravi has written the same thing, that they should have been specifically told that this by the nurse or by the doctor. I mean, and how much time would have it taken to communicate? Just little bit, that okay, ECG is fine, but still we need to monitor, or we need to do another couple of tests to make sure that everything is fine. And that would have really, brought a lot of clarity in the patient's families, understanding that not that nobody's attending to us, but we are being monitored. Now, what is the reason? Why don't we inform the family properly?
Ma'am, I have only one doubt. At least they should tell what are the financial implications if they go for such one treatment or the other treatment. After insisting many times, after asking many times, then she told, if only for angiogram, you have to ready with the 16,000 rupees. Otherwise, you should have 1.6 lakhs in your hand. If without knowing, if we go for a stunt, if we go for second stunt, you should have 36,000 more. A lot of time this happens. I mean, this is financial counseling.
Another case study you have posted.
Yes. We have parallel case studies going on, and that's a real life experience Padma is sharing with us. See, that's also quite common. We don't tell about the expected cost. This is called financial counseling. Again, now a lot of hospitals have people who do the financial counseling, who would explain the expected expenditure. We normally hesitate. Specifically, doctors are uncomfortable talking about the money part. Let's accept this. But if you will not do the talking, somebody else will do the talking on your behalf, and that talking can go wrong. Expecting a patient coordinator to talk about cardiology and angiography and stenting is something, unless you have trained that person in doing that. If the person knows how to talk about all this can be learned. But just putting somebody there in the position of a coordinator and expecting that person to do the talking is something that's unrealistic expectation. And that's why we have, Padma's version of story that I mean, I was not even told how much money will I have to spend for the angiography. And in case if my mother needs to undergo stenting, how much money will you really require to earn? And it's not a small amount. You will not have that much of money in your purse to immediately,
Even my brother is not there by that time. At least we have to arrange.
Yeah, I understand.
So
Yes,
if they don't,
yeah.
I really think I slightly like to differ over there.
Yeah.
If doctor talks about money, already the impression of a doctor says that doctors have become money minded. I really think that coordinator should do the talking about this. I'm totally concerned about the patient care. To talk about the patient care, what is going to happen? If I talk about money, the patients really go with the impression that this doctor is money minded. He's talking only about the money other than anything else. I should.
Dr. Kapoor, I want to give you a broader this thing to this. See, one is, of course, if you can train your coordinators to talk about money part and the treatment part and make them understand why one stent and why two stent and why no stent, and explain the cost, nothing like it. But what I feel, if you talk about money in a manner that they understand that this is, I mean, if you're explaining, I'm sure Dr. Ravi must be doing this with his patients for his surgeries. Dr. Ravi, do you have anybody as a patient counselor or the financial counselor?
Yes, ma'am.
There is somebody.
Everything, even a small test,
Yeah.
which is 300-400 rupees, we tell them why we are doing it, what is the need, and what is the cost.
And who
Only
does the
then
talking?
we go ahead.
Dr. Ravi, who does the talking?
I have a counselor.
You have trained?
Yes, ma'am.
So you either have to train a counselor who can do this talking on your behalf, or otherwise you will have to do the talk. But if nobody talks, if everybody is hesitant to talk, and suddenly you bombard the patient with expenditure of 2 lakh rupees, it's going to be very, it's going to be like a shock to the patient. So I'm not going to the money part now. I think we are slightly digressing from the issue that we want to discuss here. Just couple of comments are there in the chat box. I would like to read them. Dr. Farah has written, it's the common habit learned from seniors. So Farah, is it about the not talking about money or talking about money, or what? What is
No, ma'am. Regarding that question, why the patient family were not informed? Why didn't the doctor tell them?
Yeah.
I mean, so junior doctors see the seniors that they're not talking or behaving properly or communicating properly. So the juniors also follow their way. That may be a cause.
Yeah, exactly. There's no proper training. There's no proper, clarity on why we need to talk about. Okay. So what other reasons do we have to not properly inform the patient or the family about the condition? If now we are talking about only Abdul's case. Let's stick to that. In this case, why don't we normally inform?
I have listened to you before also, the balloon which we carry,
the
ego which we carry.
Quite possible. That's one thing.
That's one thing which I really remember from the last talk which you had with us.
I think that's one of the reasons we think that, I mean, I don't have to explain. What other reasons can you think of? Dr. Janvi, Dr. Rajesh, what other reasons do you think? Dr. Haq, I mean, I would like you to share your thoughts. Why don't we explain to the patient? Why don't we communicate?
Maybe to avoid some kind of lengthy discussions, it's better to, move to the next patient. Maybe the doctor is busy, so he's just on his rounds.
Quite possible. Sometimes we think it's wastage of time to explain. That could be one thing. So
Sometimes it is personality based also.
So
like I've seen even busiest of doctors explaining things to the patients patiently. Absolutely. They might be having so it is basically personality based, which I feel. Like I've seen both specialists who take their time and explain.
Yeah, absolutely. We may assume that it will take more time to explain, but the benefit of explaining is that the patient would have more trust in you. When the patient's concerns are addressed, they will trust you, and they'll actually hand over themselves to you to take a decision on their behalf. But that initial conversation, addressing their concern, has to be done. Otherwise, they'll feel that there's nobody. Like, for example, we are taking Padma. Padma, I'm not asking you to not talk about that, but then What Padma is sharing with us, that teaches us a lesson that if the family's concerns are not addressed, how dissatisfied they feel. How did and people like Padma, will they really recommend somebody to go and get the procedure done by them? Because she hasn't come satisfied, so she would not recommend this hospital to anybody else. 75% of the footfall is because of the satisfied patients who go and spread a good word about the hospital. That's the importance of sending your patient satisfied. So Dr. Ravi has written, it was a busy ICU and it was routine for the doctor and nurse. However busy you are, if you are saying just one sentence, he seems okay, we need to do some more tests. There is some change in the ECG, we need to wait for some more test reports to come. What else? Yes, Dr. Haq, you wish to say something. Please go ahead.
Thank you, ma'am. The issues that I have experienced in the hospitals, actually it is the management failure.
Mhm.
So whenever any new doctors, any consultants, whoever joined here in our country,
Mhm.
they are not properly briefed how
Mhm.
to deal with the patient attendant. Naturally, they will have some fear, they have some grievance, no? But there is a management failure because the management don't talk with the doctors, nurses on how to greet the patients.
Mhm.
Or to me, at my experience in Bangladesh, it is the key factors to have this situation like this one.
So that's another aspect of why people don't communicate, because they are not trained. They are during their induction, these things they are not told. But at the same time, you don't expect to be telling these small things to people at the consultant level. I mean, they would never take it. I don't know about your country, but in India, if you try to talk about this with the consultant, they'll say, "You think I don't know how to talk? You don't know how to. You think I don't talk to my patient?" This is how they are going to, cross question. Dr. Webby, am I right or wrong? What do you say?
I think I agree on that aspect that, it is difficult for senior learners
Yeah,
to, so that's where the role of
exactly.
facilitation is.
So, of course, I understand if there is a way where you can actually train your staff, especially the resident nurses and even those fresh consultants, in through some way, if you can sensitize them about the importance of communicating with the patient and the family, you can sensitize them. And I agree that that's a management failure as well. So, Dr. Webby, you have written assuming that they know. Again, I mean, how wrong is this assumption? How wrong is this assumption that the patient knows? And Dr. Deepika has written, maybe the doctor is not very outspoken, his personality. Again, yes, I agree with you. Some doctors would consider it important to talk to the patient and the family. Some doctors think that this is not required because what has patient to do with it? It's my responsibility to treat the patient or supervise or observe the patient or manage the patient. So family just have to be passive participant. I think the whole idea is from the doctor-centered practice, we have to now move to the patient-centered practice. And patient expectation is all about understanding what do my patient need, what my patient will be satisfied with, what will make my patient feel happy, so that the patient goes and talks good about my center or my hospital or my institute. Okay, now how did the expectations of the Rahman family change during the visit to the emergency room? How did it change? To start with, when they entered, what was the expectation?
Initially, ma'am, they were very anxious because they thought he's having a heart attack. He's very critical. And then once he was stable, they just thought they were being neglected and,
Absolutely.
everything is okay, but no one is telling us.
Absolutely.
So from a very acute phase, it became to,
Yeah, he appeared to be, feeling better, and everything looked, improving. So initially, the expectation will be that please treat me as soon as possible. Please look after me as soon as. At that point, even if you miss the niceties, if you miss the communication, if you miss talking about what it is all right. So you can see the patient expectation changes with time To start with, it is medical management. Please attend me, please attend to my condition. But it will soon change. The second would be talk to me, explain me, understand me, or listen to me and understand what I'm trying to ask. So we can't say that expectation is okay, this expectation is not okay. Expectation will vary, and we have to understand and respond and manage those expectations. Okay. Now, is it abnormal? Is this changing expectation abnormal? It is not abnormal. Only thing is we don't like, we are not happy. But this expectation changing is very normal, and it will happen even if we were in that, chair or in that position. Now, what behavior of the physician and the nurse affect the patient and his family? Can you recollect, since you have read the case study? What behaviors really affected the patient and the family?
Ma'am, lack of communication was one factor.
Absolutely.
If like the doctor should not have told that I'll be coming shortly and he never came back, or if he's busy, he should have sent, like it is possible in the gospels he could have sent his JR or senior resident, or the nurse herself could have told that
She came 2-3 times. She came 2-3 times to check the monitor, to check other things, but she did not communicate. That's
exactly,
another common problem.
That you are being monitored and so everything is fine.
Absolutely.
So that would have solved it.
Absolutely. And then towards the end, what behavior affected them?
The rude nature of the doctor listened to
the way
he spoke.
Absolutely. The way they were talking between them about the patient and the family. What does she think of herself? Are we not doing anything? And are we wasting her time? So when we talk ill like this, they have a bad feeling about the way we are conducting ourselves. So I'm just reading Dr. Farha's comment in the chat box. Trust could have been built if they communicated on time. Absolutely. So I was interacting with the doctor who is casualty in charge, emergency care in charge, and I asked her. I said, "Do you experience violence and aggressive reactions in your department, or overcrowding and mob and a lot of people coming in?" So she shared very good way she functions. She said the moment patient comes into the hospital emergency, we take the patient in and I tell the patient family member to please wait outside till we settle the patient and I'll call you and talk to you. She said once the patient is settled by my team, then I call the family members and I ask them who all are there who would like to know about the patient's condition. I would prefer if it is the close family member, so that whatever their concerns are, I can address them. She would say, I would sit with them, explain them about the patient condition, tell them what has been done. See, we do everything, but we don't let them know, so they don't know what is being done. I always say it is something like winking at a girl in dark, which she does not know. If you are doing something for the patient, let them know what all you have done. So that will give them that satisfaction that all primary care has been provided, initial care has been provided, or some investigations have been initiated, or some procedure has been planned. If you inform them, they feel satisfied, okay, all this has been done. And then she said, I have informed you about the patient's condition now. This is what we have done. This is what we are planning to. Referral has been sent, blood sample has been sent. We are going to do X-ray, CT, whatever is planned. And then I tell them that now my next update to you will be after an hour. And in case in between any one of your relatives come, please manage yourself. Don't bring them here. I will call and speak to you in an hour. So if you can identify primary caretaker of the patient, talk to them properly and answer their concerns, and then give them the time frame that I will be interacting with you in an hour or 2 hours, whatever your time frame is. They are going to understand that you are giving them time now and you're ready to give them time after 2 hours. So this whole thing could have been avoided if Dr. Raghavan, before leaving, had given 2 minutes time to the patient's family or his wife, that this is what is his condition. And they said the girl was very apprehensive, the wife was very apprehensive. Anybody will be, isn't it? Will we not be if our family member was experiencing something like this? Definitely. So let me share the presentation with you. So this is one case study I have discussed with you, but there are a couple of more case studies which actually help you see different situations and how we all behave, and how sometimes we don't look at things from the patient's point of view. But if the patient is very critical and we are not able to make him stable, yes, Dr. Kapoor, then it becomes all the more important to prepare the family for the eventuality. Prognostication is very important. If I know this patient is unstable and is likely to die, all the more important. So I was talking to casualty in charge of AIMS. He was there for almost 4 or 5 years. I said, how many times did you have the beating from the patient's family member? He said, not even once. I said, how come? I mean, there's so much of violence around. He said, every time there's a patient coming in critical condition, my team looks after the patient. I look after the patient's family. I would immediately go and talk to them and let them know that condition is not stable. This is what is the condition right now. All this we are doing for your patient, but we cannot give you assurance of the outcome till we are really sure of what is going to happen. So it's all the more important that you let them know that there is a possibility that we might lose the patient. So it's something like I always say, Jor ka jhatka dheere se. You are preparing the family for ultimately the eventuality. And can you keep the patient's relatives out? Again, on this, I have an idea. When you tell them, see, we need to pay all our attention to the patient. If you are around, we will be hustled. We will be, will not be able to comfortably look after a patient. But it has to be firm, but polite manner. हम लोग बोलते कैसे हैं, बाहर चलिए, अंदर मत भीड़ लगाइए, तमाशा लगा रखा है यहाँ पे. I remember I was taking a session for RML hospital for IGNOU students. So वहाँ डॉक्टर बहल है जो pediatrics के head हैं, डॉक्टर कपूर आप जानते होंगे उन्हें. So Dr. Behel shared his experience. He said कि we had a child, he's a pediatrician himself, so he had a child in his ward, and this child was in in a cancer state and was absolutely not possible to recover. So they were having difficulty intubating this child because pediatric intubation is not easy. So they called a doctor from the ICU, hoping that this doctor will be able to do it for us. Incidentally, patients' family members were around because they were very apprehensive that they might lose the child anytime. This doctor, the moment this doctor came in, he started shouting at the relative. He said, क्या तमाशा लगा रखा है यहाँ पे, भीड़ लगा रखी है, ये क्या खेल हो रहा है यहाँ पे, बाहर चलिए आप लोग. He sent everybody outside and he did the intubation and he went away. Unfortunately, after a couple of hours, the child passed away. Next day, the family members came in to this doctor, Dr. Bell, and they said, Doctor साहब, वो डॉक्टर कौन था जो कल बच्चे के गले में ट्यूब डालने के लिए आया था, जो नली डालने आया था? डॉक्टर बहल ने पूछा, क्यों? Sorry, I'm speaking in Hindi. Am Dr. Haq, Dr. Para? Should I stick to only English, or it's okay? Okay, thank you. So this doctor said, why do you want to know about it? He said, I know we were going to lose this child. We knew that this child is not going to survive. He's beyond recovery. But the way this doctor treated us, actually it added injury to the insult. Already we were in pain, and the way this is, I think, one of the major mistakes we do when we take the patient in the emergency. Please be firm. I'm not saying allow them to be around, allow them to be seen, but communicate in a professional manner. Can I request all of you to please wait outside? Let us settle the patient. I will come and talk to you. Do you trust me? I will come back and talk to you. Do you think the family will not listen to you? I think they will be more than happy to give you the time and space to settle the patient. The problem is we are sometimes insensitive, very aggressive. And that adds, AIMS में याद है आपको झगड़ा हुआ था? इसी बात पे, a child fell from the rooftop. Imagine a hale-hearty child playing and suddenly falls from the rooftop. The family brings the child. to the hospital casualty, and they are trying to take the child in, and the security guard is trying to just stop them and shouting at them and just trying to not let them go in. Look at the family's state of mind. They know this child may not survive. Can I be a little sensitive? Can I be a little polite? Is that too much asking from me? Unfortunately, we have not taught our staff to behave well, especially in critical care area. That's the place where the emotions are very high. That's the place where people are not in their senses. That's the place where people are not logical in their actions. They're all the more, we need to be sensible. But unfortunately, that's the place we lose our control. And we, in another case, Dr. Kapoor, you must be doing, because you are in Delhi government. So cases I'm narrating here, I think you know. In one case, the young boy who had gone to distribute his sister's wedding cards. And it's not junior doctors who don't know how to behave. I think even at the senior position, we still need to learn how to sensitively handle the situation. A young boy who had gone to distribute his sister's wedding cards, unfortunately meets with an accident and dies on the spot. His body is brought to the hospital. The doctors on duty, they announced Broad dead, and they said we'll have to do postmortem for his body. The family requested, avoid it. We know we have to do it. It's fine. We can't, let go of the rules and the regulations and the whatever the guidelines are. These family members, they go to the medical superintendent of the hospital requesting कि sir, अगर करना ही है तो आज कर दीजिए. They could not do it on the same day because they did not have the doctor. They had to call the doctor from the other hospital. And it was planned for the next day. The family requested कि sir, आज कर दीजिए. I mean, we are in a mess already. There's a wedding in the family and I don't know whether the wedding will happen or not. Can you believe what were the words of the medical superintendent? मिट्टी है, चाहे आज करवा लो, चाहे कल करवा लो. When you speak like this, what reaction do you expect from the family?
Ma'am, what is the meaning of that?
That he's already dead. It doesn't make a difference whether we do it today or tomorrow.
Oh my God.
Mitti is ashes, dust. Agreed. No postmortem done after 4 p.m. Agreed. But they didn't have the doctors to do the postmortem. They didn't have that forensic department. I mean, it's such a sensitive situation. And if I'm talking like this, nobody can stop me getting bitten. Sorry. So that's what I'm trying to bring here. A lot of time in another hospital, I'm bringing these cases, although they were not on my mind, but because we are discussing these things. So this will tell you the importance of sensitive communication. Yes, emotions are attached with the person who has just died, a young boy, hale and hearty. Imagine the family's state of mind. Now, this another boy who was playing with kite, he got electrocuted. This is again one of the Delhi government hospitals. I have done 500 programs across 35 hospitals of Delhi. So I can tell you 500 stories that I've heard from various hospitals. And they are eye-opening. They're eye-opening. So this boy, he gets electrocuted, unfortunately, while playing with the kite. He touches a live wire in the cooler, water cooler. His dead body is brought. As a protocol, we did the resuscitation. We tried CPR, everything done. Then announced Broad dead. Nothing could be done. Family accepted. They went out. Near the gate, somebody said, go back and ask them to do it once again. Sometimes miracles happen. Sometimes we can get back the breath and heart functioning. They came in and they requested the residents on duty, doctor साहब एक बारी और करके देख लीजिए, शायद बच जाए बच्चा. डॉक्टर का जवाब था, डॉक्टर मैं हूं या आप कर लो. क्या हुआ होगा इसके बाद में? So you can well imagine. That's the learning I think we need to have. In such situation, you need to be really very careful about the way you are communicating. So let me share the presentation with you because I just have 20 minutes now to talk about the topic and help you understand different expectations that the patients will have. Give me 1 second to.
Ma'am, a small question.
Yes, Padma, go ahead.
You
Yeah.
ask us to read the case studies, right?
Yeah.
When, did you post in a WhatsApp group the folder, or you send it through mail? I did not get any mail.
Padma, I have sent the course material to everyone, whoever joined the program.
At the time of joining?
Yes.
Oh, that is where I missed. I checked,
Yeah.
but I did not get. Okay.
So I have shared the course material, soft copy of, yeah. So that in that page number 33 has the 33 onwards. There are 3-4 case studies given. And I think that's what I wanted to do, but that's okay. I think you have participated very well. So coming to the topic of understanding patients' expectation, in a recent study by one of the couple of the organizations in India in 2019, they reported that 45% of the families reported that they felt unempowered in the treatment of their patient. They expressed inadequate clarity on diagnosis, reported rushed consultation, perceived lack of involvement in deciding the treatment, and lack of clarity on treatment and care options. The same study showed 35% of the patients indicated that they were not allowed to describe their conditions or symptoms in a proper manner. 32% of the patients indicated the doctor did not straightforwardly address their questions and doubts. So this is a recent study. This should tell us the existing communication and counseling practices that we have across the country. Now, if I may broadly tell you about patients' expectations, I've made a list. I'm sure you can add to it if you think I have missed something. Please don't hesitate telling me that we can add this point, and I'll add that. I feel broadly we can, categorize or put under a couple of titles patients' expectation. One expectation they have is access to information. The need to receive a clear explanation and instruction about their condition. So what Padma has just now narrated to us, what case study we have seen, I think both have showed very clearly that patients and their family member want information in clear terms, in a manner that they can understand what they are expecting. Dr. Joshi, by chance, I think you are annotating unknowingly on the screen. So if I could request you to not to annotate. Thank you. Okay, so they want access to information so that they understand what is the condition, what is the likelihood of the outcome, and other things. Then they also want ease of communication, someone responsible to listen and address their concerns. Earlier, they never had questions, but today they want to know what it is, what are the options available, what is the risk involved, what is the advantage, can I delay the treatment, what is the cost of the treatment, what will be the follow-up condition, all those things they want to understand. Third thing they expect is compassionate and empathic behavior, to be treated by staff who show care, concern, compassion. And you know it, we all expect this when we are unwell. But do we give this to our patient? That's $1 million question we need to ask ourselves. Then they like to be treated by staff who are professional in their work. So they are very, sensitive to the idea if the staff is unprofessional, when they talk loose, when they behave in an unprofessional manner. Then they expect quality care, including patient safety and prompt attention to patients' health needs, because they can't wait to receive the care, or any delay in management of pain or suffering does not go very well with them. And then they look for safe and comfortable environment. Do let me know if I've missed anything that you think patients expect from us in terms of, the way we handle them. I can see one. Oh, they expect respect. Absolutely, I agree with you, Janvi. And I think I've mentioned somewhere. Yeah, compassionate and empathic there. Absolutely, and respectful behavior.
Confidentiality, ma'am.
Sorry.
Confidentiality.
Confidentiality. Absolutely, they expect their information to be handled with care. Yes, to be treated equally. Janvi, that's so important. Today they don't want to see themselves like this. And actually, they are not. We may be doctors, but they may be equally good in their subject. If they're engineer or if they're chartered accountant or they're professor, they're equally qualified, sometimes even highly qualified or more qualified than us. So we can't assume that, oh, they're less qualified or they're not equal to us and we can treat them the way we. Absolutely. I think these are a couple of good points. Any other point, Dr. Ravi, Dr. Deepika, Dr. Rajesh Nair, any point that you wish to say? Timely man. Oh, yes. They expect timely care and valuing their time. Valuing their time is something that they really care for. Thank you for adding this point. Thank you for adding this point. So now, are these expectations unrealistic? No, but they are new. I can't deny the fact that they are new, and therefore we are taking time to accept them or give them happily. We do it, but we are not happy to do. So that's something that we need to understand. So I'm just introducing to you to a model called Kano's model that will help you to classify their expectations or their needs in 3 broad areas. So Kano's model says some of the patient expectations are very basic. For example, they are mostly unspoken and they expect that to be satisfied. For example, if they have taken an appointment and the doctor has to be there, so that facility has to be there, or there has to be waiting area, or there has to be a toilet in the hospital or in the OPD area. So these expectations are basic and they are expected to be satisfied. So when these expectations are met, they are not going to acknowledge because that's something very basic and they expect that to be looked after. But when these expectations are not met, they are dissatisfied. Now, from the list of expectations that you have written in that visit, the first activity that we did about expectations mapping, can you write at least one expectation that you think is basic in the chat box so that we have a couple of answers from all of you? Right? One of the expectations that you think will fall in this category of basic. Availability of doctor. Yes, that's a very basic. Clean space for waiting. To be heard. Waiting area. Yes, agreed. Agreed. So if a patient is admitted, there has to be a bed. There has to be a mattress. The mattress has to be covered with a clean sheet. That is something very, very basic that your patient will definitely expect from you. The second set of expectation is called satisfier. So that means if you are able to give or meet that expectation, patients are going to be satisfied. They're going to be happy with you that good, that this thing is looked after very well. So these are the expectations. When they are met, the patient is satisfied and is happy. For example, there has to be a toilet. But if the toilet is clean, definitely the patient is going to feel, oh, the toilet was good. Or waiting area has to be there, that's basic. But if it's a clean waiting area, or the waiting area is well ventilated, or well placed or well kept, that becomes a satisfier. So when these expectations are not met, even then your client or your patient is going to be dissatisfied. The moment they will enter your restroom, if it is unclean or it is dirty, they'll come out. Oh, ganda hai, ganda hai, ganda hai. That means they're going to come back and even write in reviews that this is, not very well cut. So these are also mandatory. Please remember, satisfier and basic expectations have to be met if you want to send your patient satisfied. Can you write some examples in the chat box that you think will fall in the performer or satisfier category? Clean linen, yes. Behavior of the staff and doctor, yes, Deepika, I agree. Time management, timely management, yes, Dr. Farha, agreed. Yeah. Good reception staff, absolutely. Properly conveyed information. Yes, Padma, I agree with you. Yeah. So when these things are there, you feel good. Patient goes satisfied. Patient will go and talk good about you. They'll say it's a good hospital. It's quite neat, quite well equipped. Staff is very nice. They're very well behaved. They value your time. They don't make you wait. Yes, sense of respect. Yes, Ashim. So if the staff is respectful, they feel that okay, I have been given due respect. I have been looked after very well. So this is something again we need to look after. We need to make sure that these things are available or these actions are taken by us. Now, coming to the third category, if you really, yes, hygiene, I agree, Padma, that's right. The third category is actually what most of the corporate hospitals are encashing on. But if you, even in the smaller setup, if you try to bring in these, you will find a change and also a lot of, good feedback for the way you're working. So that is called actually delighter. This category of expectations are patient has a need, but does not expect that need to be fulfilled. And when that need is fulfilled, that comes as a delight. That comes as a delight. So can you think of anything that you are doing in your hospital? For example, parking, valet parking. So when you're giving valet parking, that's something patient did not expect. But when you say valet parking is free, you can leave your car and go and get your treatment done. We'll park your car. That's going to be a delight. So can you think of any writer that you are already, oh yes, Dr. Farhas, oh, Wi-Fi availability. Yes, that has become that's become a, delighter, I think. Absolutely, absolutely. Or having a coffee shop or having food court and very nominally priced, not like exorbitant, but something that, yes, tea and coffee. Absolutely, Dr. Ravi, I agree. Tea and coffee. And if it is free, oh yes, Dr. Janu, you have written free coffee for living. It comes as a delight. It comes as a delight for them because they need it. They really need it. But they know they can't expect, but they get it. Yes, Dr. Deepika, I agree. Report sent over message or email. That is actually, now people are really, now of course it's becoming again a norm, but that's a delight. That's really helpful. AC in the general ward, even for BPL. Absolutely. A personal escort to help. Yes. We give chocolates to all kids. Again, wonderful. Celebrate birthday. Yes, this I'm seeing happening in a lot of hospitals, that they would celebrate the birthday of the patient or send a birthday card after the patient is discharged or birthday wishes. Absolutely. This I do see in a lot of hospitals. Able to communicate with patients and relatives through video call. Yes, I think again a very good input, especially during COVID time. We all have seen that patients and relatives could not see each other, could not talk. And that's where when such improvisations were made, they were more than happy that there is somebody who's understanding my need. So I think this gives us an idea that at least the basic and the performer needs or satisfier expectations should be met by all of us. But delighters can be added to add surprise to the service you are giving to your patients. Now, coming to the consequences of unaddressed expectations. Write in the chat box if the expectations are unaddressed, especially say in a government setup. I think that's where we are probably failing. What are the consequences? And of course, in the corporate sector, if you don't address your patients' expectations, what are the consequences? What will happen? Write in the chat box, please. Poor patient satisfaction. Absolutely. I agree. Dissatisfied patient, poor patient. Dissatisfied patients, unruly behavior of the patients. Yes, they can become aggressive. Rude behavior. Yes, they can also become aggressive and violent with us. Chances of litigation. Absolutely. Loss of trust. Bad Google reviews. Yes, Dr. Ravi, that's very common. That's very common. I was attending to a boy who was under my counseling. So he said, I went to dentist And instead of attending me, he attended another patient who came after me. But because I was young, so he just did not bother to even let me know that I need to see this patient first. I said, what did you do? Didn't you go and talk to the receptionist? He said, no, I just went and wrote bad reviews for the doctor. That's how they now use, Google reviews as a way to write bad reviews. So they will not return. Yes, you will lose your patient. That's the biggest loss. Bad publicity, bad reviews, even in practo. Yes, I completely agree with you. I think we have covered most of the points that have been done. Definitely, if the patient is dissatisfied, there's a possibility that they might write bad reviews for you. There can be reduced footfall. It may actually lead to bad reputation of the hospital, frequent conflicts leading to risk of violence and aggressive reactions, risk of litigation, and then definitely reduce professional satisfaction among staff. If every day you getting into these kind of situations with your patient, there is no satisfaction, there's no happiness. Yes, violent behavior is another problem. And then they may ask for discount leading to revenue loss. That's interesting, Janvi. I agree. Because if they see we are on the we are losing ground, or we are not actually able to give them value for money, so they may even say that, we are not satisfied, I'm going to call police, I'm going to litigate against you, either you give me discount or let me go without paying, or otherwise I'm going to litigate you. I think these kind of blackmailings we do get to hear from various sources.
Some kind of threats also coming.
Yes, that's also one of the risks. There is that. So if we can broadly, talk about the patient satisfaction, there are 8 essential elements of patient satisfaction. One, the communication with nurses, because they are the one who are mostly around patients. So most of the requirements, needs, expectations, they're first communicated to the nurses. If that can be looked after, simple thing like, I can't have this food, can I get something else? If a nurse can arrange that by talking to the cafeteria or to the mess or our canteen, whatever the right sources, a lot of their problems get resolved at that point. Then communication with the doctor. There are certain things that only doctors can communicate. So that communication need has to be met. I have seen surgeons who would not talk to the patient. Dr. Devi Shetty had shared his experience. I don't know if you heard his TED talk. He said, he started his initial practice in Kolkata, in I think Birla Hospital. He said he used to see 100 patients a day. Actually, he wrote this in one of the forewords in one of the book. I read that there. He used to see 100 patients a day, and not even a single patient came for surgery. And when he got into the detail, he realized that he was actually not communicating with the patient. He was very mechanical in his approach. He changed his way of interacting, and we all know the kind of practice he has. So communication with the doctors is very gratifying for the patient, and that cannot be replaced with any other thing. Then, of course, they want some communication about medicines. They want to be explained what medicine, how much to take, how long to take, what side effects. Then responsiveness of the hospital staff. Pain management, that's another important area which adds to their satisfaction. Cleanliness and quietness of the hospital environment. Discharge instructions, and overall hospital rating. So these are all important 4-8 areas if we can work on that can create patient satisfaction. So this is where I want to introduce you to the concept of design thinking. If I may ask here, has anybody heard of design thinking as a tool, or have you used it anywhere? Design thinking. Anybody? No? Nobody? So design thinking is now extensively being used by many, many organizations. So the services that you're getting on Amazon or Zomato or Uber, they are all actually the brainchild of design thinking. So design thinking is a concept in which you actually follow certain steps to understand what your patients need, clients need, they expect, and how can you create delight for them. So these are all various organizations, various, service providers who are actually using design thinking as a concept to design these services to meet your requirements. So nobody thought of Oyo and Uber and Zomato, but when people started looking at situations from the public's need or requirement, and we all know how we are getting everything at the doorstep because of these services available across the world. So this is the concept of design thinking. It has major 5 steps. The first step is empathize. In empathize, you actually develop a deep understanding of the situation. So the expectation mapping that we did in the beginning, the first activity that we did in the beginning was to actually take you through your hospital as a patient rather than as an employee. So visit your hospital as an employee, no, sorry, as a patient. Sit in your OPD as a patient. Use patient's toilet. You sit in the waiting area of your hospital to see what challenges your patients must be experiencing. Lot of organizations send mystery customers. They send mystery customers to see how do my staff behave, to understand what challenges patients must be experiencing. They'll give anonymous call to the receptionist and ask for some information and see how the receptionist gives or delivers the information to understand how is my staff behaving. So the first step is empathize, where you actually try to develop a deep understanding of the challenge by actually doing the process mapping. The second step is define. In define, you actually articulate the problem in a manner so that you now know what am I dealing with. For example, if you want to work on the waiting time of your, if you have been able to identify a waiting time, excessive waiting time for the patient, which is leading to a lot of other problems. So maybe you will define that I want to cut down or minimize the patient's waiting time. Third stage is ideate. Ideate is more like brainstorming, where you create ideas to see what all can we do to minimize patient's waiting time. So it is not just you who will be doing the brainstorming. It's a good idea to get ideas from people who are even not from healthcare. They will give you a lot of wonderful ideas to actually provide you options that you can try. So ideate is actually, even the most weird idea can give you I remember I have read this story somewhere. How far that is true, I don't know, but I can give you an idea. So there were two, salesperson or sales managers who were discussing how to increase the sale of toothpaste. And they were discussing this in a bar. Have you heard of this story? Have you heard of this story? No. So these two salespersons, they were sales manager, they were discussing how do we increase the sale of our toothpaste. So it was a bar boy who was listening to their conversation, and the bar boy said, increase the size of the mouth of the toothpaste. Automatically the consumption will go up. If you have ever noticed, if you talk to the dentist, they will say, use toothpaste of the size of a pea, matar ke dane. Whereas if you will look at the advertisement, they will actually cover the whole toothbrush, almost like 1.5 inch with the toothpaste. So that's actually going to another side of the ideate. But when you will talk to your team, when you will ask your staff to give you ideas, when you will talk to outsiders to brainstorm and give you ideas, how can I cut down the waiting time of my patients? I'm concerned about it. I want to cut down my patients' waiting time. How can I get more ideas? So ideate. Out of those ideas, you will be able to actually find some ideas that will work for you. So at this stage of ideate, I can introduce you to a concept called create. You can note down, it is not there, but it will help you. The concept is create, and please write in capital, CREATE, create. So this is an acronym. So CR stands for current reality. So when you're creating ideas, what is your current reality? Note down that. List down what is the current reality. So list down how many patients are coming every day, how much time can I give, what is the waiting time, for which area are the patients coming, or what are specialties I am attending. All that you can note down. Then the second is EA, and that's called explore alternatives. Explore alternatives has two phases, mining and shining. So mining is dig as many ideas as you can. It could be most weird idea, don't worry. Write down that idea. So usually when we get this activity done in a group setup, we actually have stickies and we ask people to think and write their ideas on the whiteboard, so that we have a lot of ideas and there is no name who's giving that idea. Because when it comes with the name, people are scared. Somebody will laugh at me, somebody will make fun of the idea I'm giving. But when you say you don't have to write your name, but just give your ideas, they will give you a lot of ideas. So one is mining, and then second is shining. It is, I'm talking under EA, explore alternatives. So mining and shining. So take out 7 to 8 ideas, do SWOT analysis of each idea, and then maybe out of 7, 8 ideas, you may find 2 or 3 ideas that you think are workable, feasible, doable. And then do the shining of that idea. So out of 2, 3 ideas, maybe you will say, okay, these 2 ideas, I think we can try. Then create prototype. So prototype is where you decide, okay, this is how we are going to. For example, if you think a lot of patients are, coming during these hours, can we have an afternoon OPD for special clinics so that we can divide the workload? Can we have 2 morning evening OPDs running parallel? Whatever, I'm just giving you an idea. So prototype is like whatever final couple of ideas that you have picked up, you test them, you apply those ideas. Now you did the process mapping or the visiting your OPD as a patient. I'm sure at number of places now you must have identified either the problem with the parking, or the person at the reception, or in the waiting area, or the doctor's chamber, or the lab, or pharmacy, or even restroom, whatever. You can pick one area, use this technique as a design thinking concept, and apply to make that place better. So in empathizing, you're actually trying to learn about the audience from whom you are designing. You can even interview them, take their feedback, ask them, what challenges do you face accessing my hospital or my clinic? They may say, the timings are not suiting us, or the distance is a problem, whatever. Or we don't get information about your setup, whatever. So, and then you define the problem, ideate, prototype, and test. And that's one way I would say you can, start working on one problem at a time. Don't pick up a lot of things, and pick up the easiest one. Because once you will taste success, you will be, motivated to apply this further to improve your services. So patient expectations are not something that are unrealistic. They are new, but they are going to further evolve. And they're going to change at a very quick pace. So these are a couple of examples I'm sharing with you. I think Siemens and Philips have used this technique where they are trying to, set up MRI setup for the pediatric clientele, because they know kids get scared of looking at the huge machine. So they have tried to give it a feel of a PlayStation or a playroom, where the child feels comfortable, child enjoys the colors. Again, this is a waiting area of one of the hospitals. So this is to make them feel comfortable, to make them feel okay, they can relax, they can even while being there, they get some peace of mind or some relaxation. Again, this is an OPD of one of the hospital or waiting area. So it's, I think, time that we understand what our patients expect from us, and try using this concept to understand your patient's expectation and meet them midway. Yes, Padma, go ahead.
The same doctor where the doctor has another hospital consultation. In that hospital, they put a big screen of movie for waiting area, and very beside of the waiting area, there is a cafeteria. Coffee, tea, water, and popcorn and biscuits are available over there. And when my mother is not able to sit in that chair because of that is a metal chair, they have a separate room which have cushion sofas. That was very much.
Again, they have thought from the patient's perspective, and they have tried to improvise. Thank you for giving that input. Any questions about what we have discussed about patient's expectations?
Somehow we need to involve the stakeholder, that is patient also, isn't it? Somehow we need to involve them also in all this design thinking. Because absolutely, perception of that may be different than perceptions of mine.
So see, when you are planning to renovate or planning to change your functioning, you can have patients as one of the team members who are going to work on it. In our country, we still don't have the concept of patient advocates or patient as a team member. But in Western world, I mean, there are committees, there are bodies where we have patients, and they have a lot of voice. Yeah, sorry, Dr. Ravi. Thank you for, oh my goodness, you are really keeping an eye. Thank you. So TE is tap energy. Whatever you think will work, tap energy. Give your 100% to make that work. Thank you for reminding me. I get carried away sometimes because there's so much to talk, and then I may miss on something. Thank you. Any questions about what we have discussed, or you want to add something to it? I think my whole idea of having this topic as one of the beginning topics before we move further is to change our perspective, because we normally think patients' expectations, and we have this frowning face. Oh, it's unrealistic. They are very demanding. They don't realize what we are going through, what our challenges are. Even if they don't realize, it's my responsibility to help them understand what challenges I have. I need to even communicate that. How will they know unless we tell them? So even that communication has to be.
I want to add something.
Please go ahead. Yes, go ahead.
You are telling, and we also feel that we should increase the quality of environment, especially patient waiting area. And what she told, there is a movie screen, and beside that there is a cafeteria. It's okay for corporate hospital, and those are A category hospital. It's expensive, but we in our country, especially in India and Bangladesh, it is overpopulated country, and most of the people who are seeking for healthcare service, they cannot pay much more. And especially we are concerned about these people, because they are the majority people. So there is a lack of connectivity between patient and physician. It is the reality right now. So what I want to say here, we should give a deep attention at how we can connect, soul to soul connect, and feelings to feelings connect. These are the main fact, and we should think more in that area. We are feeling that because physician, they are burdened by number of patient. A doctor has to handle more than 100 patients in a day.
Yeah.
And it is really tough to keep their mind cool and calm. It's a problem really. And in that case, we should focus on that spirituality and what I can say, calmness and clarity. And these are the
Absolutely, definitely. See, I think looking after yourself is very important. If I want to give you something, I need to have that with me. If I want to give you happiness, I need to have happiness in me. If I want to give you contentment, I need to have that with me. So spirituality is, of course, empowering. But the thing is, I can do it for myself. I can't recommend to anybody. And will people listen to me? It's something that comes from within. But if I can look at things from patient's point of view and see, for example, if the doctor is not able to talk, can I have somebody else who can talk, do the talking for the patient, for the doctor, so that patient's need is fulfilled? So there are so many CSR projects, companies are there who are ready to, provide services, provide materials, because if there is somebody who can, use their funds in a right manner. And I see a lot of government hospitals and government bodies also engaging with them and getting their services so that they can make their place better. Absolutely, that's the idea. Yeah. So meditation in hospitals in Shivani is, yeah, I know. They do it. And in a couple of hospitals, we have this facility where we have a meditation room, and people teach about the art of living and Om Shanti also. True. Thank you. So I think I'll stop here, and I'll share the feedback form in the group. As usual, I'm receiving only 8 to 9 feedbacks. I read everybody's feedback and I try to respond also. I would request that give your feedback so that we can make things better, improve the program. Now I would request Dr. Vaibhavi and Dr. Farah, I hope both of you are ready.
Yes.
My only request is that please stick to 10 minutes timeline, because I know you have a lot of content and a lot of experience. So if you can stick to 10 minutes timeline, it will be really great. So we'll have first presentation by Dr. Vaibhavi. Is that okay?
Yes.
And
Okay.
then Dr. Farha. So I'll just give you the option to share your screen.
Okay.
Yeah, I have given you the rights to share your screen. Yeah.
Are you able to see my screen?
It's not started, but yes, we can see it's black otherwise. Yeah.
Okay. It should come.
But it's saying that it is screen sharing. Can
Yeah.
you try changing other sheet? Screen?
Yeah, it's actually, I have shared it.
Yes, it is there.
Okay.
Yeah.
Can see now?
Yes.
Okay. So for everyone's information, this is the mentimeter.com website. If you actually type it on Google Chrome, you will come across this page. Okay. Can you all see this? Can you all see this page?
Yes, we can see. Yeah, we can see.
Okay. So here is where we log in. Since I have an account already, I can log in, but the account is completely free to be made. So you can all make an account here by signing up, and it's free for usage. So please do sign up and then log in. Okay. So I'm going to log in now just to give you a feel of how it has been.
We have to log in now?
No, I'm going to log in now.
Okay.
So once we log in is where we will see this page that comes in. Okay. I'm going to tell you about the free version of Mentimeter, which has quite a number of features. We can make presentations using Mentimeter even with the free version. There are other versions as well, but if in case we want to use it for training purpose, we can always purchase them later, but most of the times we do not need one. So like we see, this is the front page. If you can see the new presentation, I click on that now and I name this presentation as, let's say, communication. So I name this and I type create. So let's make one new presentation. Okay, so my communication presentation has now started and it is giving me a lot of options to make the slides. So if we click on the new slide, it gives me a lot of options here. What is the type of slide that I want to make? So first, I'm actually going to try out few slides. One is called as word cloud. Word cloud is a different type of slide where all the participants, all of you, can actually type in the answer and it will come on this slide. So my question to you is, are you all hungry? Okay. So my question to you all is, are you all hungry? Once I have typed this slide, then what I do is I go to something called as a present. Okay, I click this and it goes into the presenter view. Here, I would request all of you to use your smartphones, and using your smartphones, you can type www.menti.com on Google Chrome and enter the code, or you can straight away use a QR code scanner and scan this code. It takes you directly to this website. This website gives you the option of answering all the questions that I'm going to put now. So just give me a verbal confirmation that all of you have been able to access menti.com using this QR code, or straight away just enter the code in it.
Yes, I could access.
Okay, great.
Yeah, even I can.
Fantastic. So I'm just going to remove this QR code for now. I can see a big yes here. Okay, so I think there are 3 of them who have said yes. I am going to type as well. Okay, so there is dinner is,
Had dinner.
had dinner. Okay, so somebody has typed had my dinner and some people have yet to have, so they have typed yes. So as you see this question, all the participants are able to type through Mentimeter and all the answers are here. Now, a very important thing, more if they type yes, this yes becomes bigger. So if the word which is big, it is typed by many people. Okay. On the right hand corner, if you see, there is a small count. There is a human figure on the right, and you can see 8 people have commented. Okay. So out of 13 participants, total of us, 8 have participated. When we have the pro versions of this Mentimeter, we can also know who has commented what. Okay, so, but that's for future. We can allow as many participants to come and comment on this, and the slide will get full. Okay, but I can't give an unlimited time here, right? So I'm going to give something like a voting counting. Okay, so let's look at if I have to give a countdown. So can you see I have on a countdown by pressing the number 1 on my keyboard.
Okay.
So here the countdown begins. As soon as 1 minute is done, the voting will automatically close and you will not be able to type an answer. Okay, so I can limit the time frame for this slide. Okay, so for now, I'm ending the voting here and I am again going back to my original slide. So I'm just going to escape and take you back to the presentation mode. Okay, so like we are now back here. Okay, I just will hide this floating. Yeah. All right, so now we have seen one slide. How about making another one? Okay, here we will use a multiple choice question. Okay, so the next slide has a multiple choice question type. So let's say we have a multiple choice question, which is your favorite pet? Okay. All right. And here on the right, I'm still have to write my options because I'm giving them a choice, right? So I will write a cat. In the second option, I will write a dog. And the third option, I will write a fish. Okay. So I have entered here. If you see, there is a small picture icon. I can actually click on that. And then there is a huge image library that opens up, which gives me an option to select from the image library of Mentimeter, or I can upload from my computer. I can also do GIFs if I want. So there are lots of options here, which currently is taking a little while. But then once you open the image library, lots of images will come in. I think it has opened my, I don't want this. Okay. So let's see if I click the image library and I say it's, I want a picture of a cat. Okay. So if I select this one and say, okay, and save it, this actually gets saved in the option near the cat. So there is a visual impression that the people will have. Okay. So likewise, a dog can be selected, a fish can be selected. Then I would like to see the layout as a bar diagram, like which is now here. I can select a donut. Okay, I can select a pie, or we could select a dot. So which all do you want to select? Do you want to have a pie chart? Yeah, so let's try a pie chart. Okay, now here I'm going to do the present again. So whenever you have to do a presentation, you'll have to go to the present mode. So now I would request all of you to go back to the menti.com, enter this code, use the QR code either, and type your answer, please. Okay, so somebody has already mentioned dog. There are 2 people. Okay, there are 5 people whose favorite pet is a dog. Okay, I think I'm one of them. Anybody else who likes cats? Okay, there is a fish lover here. You mean fish as a pet or fish as a food? Okay, so yes, okay. We also give a countdown. So let's give a countdown of 10 seconds, not more. All right.
Oh, you're a great dog lover.
Exactly. Now the voting is closed. Now you cannot vote. Okay. I can open it if I want, but if I don't want to, it just ends it there. Okay. All right. So we escape again. So likewise, you know, this is a huge presentation platform where there are n number of slides. So I'm not going to take you through all today because we don't have time. But as you can see, there's multiple choice. There's a word cloud. There are open-ended questions and answers. There are scales. There is a ranking. There are Q&As. Okay. There is a quiz and competition that you can do. This is all possible with the free version. The content slides, you can put a heading, you can put a paragraph, you can put bullet points, you can put an image and ask about it. Okay. You can put a document to read. You can put a video. Please remember the video section, especially you have to remember that the YouTube links can be posted here. Okay. But a downloaded video on a laptop is yet not possible to be shown through Mentimeter. But yes, a YouTube link can be posted and it directly opens all the YouTube videos without coming out of Mentimeter. Okay, you can put quotes here. Okay, you can put instructions. Now, if you see a star here, as you can see, this star means it is for the pro version. Even here, if you can see, there is a beta written. So these are all paid versions, but they are more advanced stuff. And generally, when even I started using Mentimeter, I still don't need that. Okay. Even if I have purchased, I've really not needed it. So actually the free version gives quite a number of features that we can actually use. So if you see this, the whole, Mentimeter, it's amazing. Even here, who will win? If you see this, who will win? Actually, it's a competition that you can create with Mentimeter. So all of them is like a fastest finger first, at the same time, who is giving the correct answer. So it creates a kind of a gaming situation when you are trying to do a kind of, a learning, and people really enjoy when there's a game involved. So if you can see all these open up to all aspects on the right, every slide will give you what you want to choose. And that is how we can put in our inputs. We can customize it. So while customizing, there are lots of options such as layouts. I can change the layout of how the slide is going to be. I can put an image. Certain advanced layouts we need to purchase, but like I said, I never had needed to purchase it till now, though I'm using it quite often. You can change the themes of the background like we do it in PowerPoint as well. All right, and I think pretty much this is what is about the Mentimeter. Now I'll go back and show you that I have a host of presentations that I have made here using Mentimeter. And there is something like a feature which is import presentation. That means if you have a PowerPoint presentation already, with a advanced version, you can bring it and put it in this as well. So it directly saves a lot of time. Okay. Here on the left, if you can see, you will have tutorials. That means you can actually go through all the videos of how to use Mentimeter. So in fact, what I'm doing now, you will actually see it in this video, okay, how to create your first Mentimeter presentation. You will see a video which is, can I use Mentimeter with a PowerPoint? Then can I use Mentimeter to take votes from the participants? How to create a survey? These are all possible using the free version. These are about the tutorials. Now, there is something very important that before I end, every presentation that we make, okay, so if we open that presentation, this is crucial because we are interactively, asking the participants to participate. We have to go to settings of every presentation, and there we have to choose a lot of options here, especially the one which says profanity filter, because in the free version, we really do not know who is typing what. Okay, especially with an unknown crowd, people can talk, can write anything like some bad words, anything that is not, you can say, not nice to write. In that case, you can put something like a profanity filter, which is in following languages. As you can see, all the possible bad words are there, all the profanity filters are set, and all the filters are ticked, as you can see. So all the known bad words are blocked. Okay. So this is extremely important when we do that. As you go and see all the aspects, you will realize that if you want some feature, you want comments from the audience, then you can just allow this. Okay. If you don't want audience to give comments, you can block it. So you can choose how you want to run it. Okay. So this is the most important aspect in the settings that we have to remember to use. I guess pretty much I have covered. If the time frame allows, I can take one more aspect. Is there time, Dr. Indu?
I think that's enough. What I would suggest, let them try their hands at it. And in case if they have any challenge, then maybe we will have another 5 minutes discussion with you in the coming sessions.
Yes, and I will also post all these YouTube links in the WhatsApp group for all of you. So you can at leisure see those videos.
Sure. I think that's a good idea.
Okay, so I will escape this now.
Thank you so much to have introduced a new tool to all of us. For me also, it's a new tool. Thank you.
Thank you, ma'am. Thank you.
Thank you.
I will now stop sharing. Okay. Yeah, okay, got it. Thank you very much.
Thank you so much. I think it's a new learning for all of us, and you never know where you might use it, not only for training but for many other purposes.
Yes.
So you make presentations also on Mentimeter?
Not routinely, I use PowerPoint when I have to address people. But
Mhm.
when I want their interaction, I actually use Mentimeter even when they're in person in front of me.
Mhm.
Because it is like a gaming, no? So
Yeah, they enjoy, they can see their answers on the screen.
Yes.
So I remember this was used once I had gone for my training in US. So there one of the presenter had used this feature, but I didn't know about it at that time. I'm
yes,
talking about 2019.
right. It
So
is a
but
recent one, I think few years only.
yeah, yeah,
Even I
19.
haven't explored all the features yet. I'm slowly finding out every time I use, I said, oh, this is there, we should use it. So
Interesting, very interesting.
Thank
Thank you so much.
Thank you.
Thank you. Wonderful. So can we move on to Dr. Farha now? Dr. Farha, are you ready?
Yes, ma'am.
Please go ahead. Yeah. You can share your screen or if you want to first share the story and then show us this presentation. You think that will be better?
Sure. I want to share the screen.
Sure.
Oh, okay. So is it visible?
Yeah.
Welcome, everyone. I'm Dr. Farah. I'm going to present on pedagogy of storytelling in a program. So I will choose a topic, and on that topic, I will tell a story at first. So I have chosen the topic on empathy. So what is empathy? It is the ability to share someone else's feelings or experiences by imagining what it would be like to be in that person's situation. So the story is about a farmer, his puppies, and a little boy. So the story goes like that. A farmer had some puppies he needed to sell. He painted a sign advertising the 4 puppies and set about nailing it to a post on the edge of his yard. As he was driving the last nail, he noticed a little boy. He looked into the eyes of the little boy. Mister, the boy said, I want to buy one of your puppies. Well, said the farmer, as he rubbed the sweat off the back of his neck. These puppies come from fine parents and cost a good deal of money. The boy dropped his head for a moment. Then, reaching deep into his pocket, he pulled out a handful of change and held it up to the farmer. Is that enough to have a look, sir? Sure, said the farmer. And with that, he let out a whistle. Here, Dolly, he called. Out from the doghouse and down the ramp ran Dolly, followed by 4 little puppies, which looked like balls of fur. The little boy was very happy. His eyes danced with delight. As the dogs made their way to the fence, the little boy noticed something else stirring inside the doghouse. Slowly, another little puppy appeared, this one noticeably smaller. Down the ramp it slid. Then, in a somewhat awkward manner, the little puppy began hobbling toward the others, doing its best to catch up. I want that puppy, the little boy said. The farmer knelt down at the boy's side and said, Son, you don't want that puppy. He will never be able to run and play with you like these other dogs would. With that, the little boy stepped back from the fence and reached down and began rolling up one leg of his trousers. In doing so, he revealed a steel brace running down both sides of his leg, attaching itself to a specially made shoe. Looking back up at the farmer, he said, You see, sir, I don't run too well myself also, and he will need someone who can understand. With tears in his eyes, the farmer reached down and picked up the little puppy. So the story has reflected empathy in a very prudent way, I think. So moving forward with the presentation on the storytelling pedagogy, we all know that it is a very important form of pedagogy because humans are storytellers. Not every human culture in the world is literate, but every single culture tells stories. We have virtually forever used stories to communicate, to pass on wisdom, and to ignite imagination. So storytelling has its place in professional education outside the classroom as well as inside it. It has served to fill up the gaps between the codified professional language, peer-reviewed and doctrine, and rapidly changing current circumstances or best practices. So it has many advantages, like it is a universal way of passing knowledge or wisdom to the listeners. We learn better when the content is presented in a story rather than a lecture. Because humans are natural storytellers, we immediately pay attention to the structure of a story, and we often get involved emotionally with the story. This involvement helps us in content retention with obvious benefits to the audience. Stories break up the mundane. They package our ideas in relatable and interesting ways. They keep things slightly unpredictable, making audience curious and ultimately reveal something meaningful and insightful. It improves the listening and imagination skills of the audience, and also it boosts our memory. Storytelling helps deepening the understanding of the subject, and it also increases our attention span. There can be some disadvantages. As it is a passive process, there can be less questioning and less active participation. It can be monotonous if excessively used. And it also requires skill to deliver a message through storytelling. Otherwise, can lead to messing up with people's ability to understand the basics accurately. Storytelling stories are not objective; they're very much subjective, because the stories are relived by the storyteller. Because it uses emotion and elicit emotion from the listener, they often remain fresher in the mind of the listener than a peer-reviewed study or any journal. It replaces information with narrative, eliciting an emotional response, so it can impede the listener's rational judgment. So while telling stories, we should remember to do some things, like before presenting a story, we should know our audience well, for whom we are going to tell the story. It can be for children, it can be for doctors, it can be for business people. So accordingly, we need to prepare. And we should use simple and easy language. The story should be such that it relates the practical scenario of the content. We should focus on the primary content or the message to be delivered, rather than the story itself. The stories have to serve the purpose of our presentation or talk. And we should not make it too long or too short. We should put right level of details. So while storytelling, we should also see how we are delivering the story, because it can be impactful if it is delivered in a very skilled way. So, which is why we need to be practicing our foundational speaking skills. And we should also moderate our stories when necessary. Last but not the least, we should practice beforehand so that we can accurately time them out and deliver the story properly. So while storytelling, we should remember that we should not put too much or too little details. It should be in proper detail. So storytelling can be a trap for going over time. So we should not go for too long. And we should not try to tell too many stories, and it should not be irrelevant. And we should not just read the story. We should genuinely get connected while telling it to make it real. So storytelling can be used in everywhere, I think, in education institution, business, healthcare facilities, and everywhere possibly we can tell a story. So in conclusion, we can say that as long as people have spoken to each other well before the discovery of written language, storytelling served to pass down cultural, ethical, and other information from generation to generation. So it has been, it is, and it will remain one of the mainstream effective ways of facilitation. So that is all from my presentation. Thank you all for patient hearing.
Thank you so much, Farha. Thank you. Can you stop sharing?
Okay. Thank you, ma'am.
Thank you. Thank you.
Thank you.
So I think storytelling is one of the most interesting way of engaging your audience. And if you can really find a story that conveys the message, I think it can do, it can save you a lot of time and have a huge impact. And we are using this very often. Only thing is, let it come from your heart. Then it would have a real impact. But thank you, Farha, for telling about the do's and don'ts, advantages, disadvantages. And also some of us are not in habit of using storytelling as a way to teaching. It's very useful. It really works wonder. And I often use it only after I read about storytelling. I realized that okay, that's why audience gets connected with you. Thank you. So I would not hold you further. It's already 10:15. I'm trying to keep the time around 10 so that I don't hold you further. And I saw the time in Farha's laptop was 10:40 because they're half an hour ahead of us, if I'm not wrong. So it's almost like 11.
Yes.
I'll be sharing the feedback form in the group. I request all of you to give your feedback. Any questions we have, I mean, we can spend 1 minute or 2 minutes in if there's any doubt, any question, anything you wish to say. But when you talk about pedagogies, I would like you to not just present, but actually work on it in a manner that it comes as though you are already doing it and you are understanding it. Thank you. Thank you, everyone. Bye-bye. Good night.
Thank you. Bye-bye.
Thank you.